to start.
Come in. Hi.
Hi, I'm Dr. McCarthy.
Amy Cohen.
Nice to meet you.
You too.
So what seems to be the problem today?
Over the past couple weeks, I've had like a really persistent cough and fevers, and I've just been really run down with fevers and chills and just not feeling well.
Alright, so this cough, how long would you say it lasted?
Probably about 2 weeks now.
Alright, and when you cough, do you cough up mucus?
Yes.
Alright. What color would you say that mucus is?
Yellowish green.
Alright. Have you ever coughed up bloody mucus?
No, I haven't.
Alright, that's a good sign. Alright, so how long would you say you've had the fever?
Probably about as long as I've had the cough, maybe a little bit less.
Okay, so I'm going to start off doing all of the... And can you open your mouth and say ah? Okay, everything looks good in your ears and your mouth. I'm going to go ahead now and take your temperature. Alright, you can close your mouth. Alright, you have a temperature of 103, so you definitely do have a fever. I'm just going to go ahead now and check your blood pressure.
Okay.
Alright, your blood pressure looks good. It seems the same as those who have tested positive for pneumonia, so we'll just keep that in consideration when we're doing all the other tests.
Okay.
Okay, so have you experienced a sharp or stabbing pain in the chest area?
When I cough, I feel a lot of pressure and kind of like a stabbing pain, but it's not consistent throughout the day, just when I'm coughing.
Alright. Do you have a headache?
Yeah, I have been getting really bad headaches. I suffered a concussion a couple of months ago, so I've been having on and off headaches since then, but since I've had this cough, it's been seeming to get a little bit worse.
Alright. Have you had headaches every single day since the concussion?
No, just not all the time, like every so often, but since I've had the cough, it's definitely been more consistent.
Alright. Have you noticed excessive sweating or clammy skin?
A little, yeah. I've had a bad fever, so I've been...
Yeah.
A little bit, yeah.
Alright. Have you experienced a loss of appetite, low energy, or fatigue?
Definitely. I've been very run down, so I haven't really had an appetite and haven't been sleeping a lot at all.
Alright. Have you been feeling a little dazed or confused lately?
Yeah, somewhat, yeah.
Ever since the cough started?
Yeah.
Okay. How about wheezing? Have you been wheezing lately?
Sometimes in my cough, yeah, I can feel myself wheezing a little bit, but it's not throughout the entire day.
Okay, I'm gonna go ahead and listen to your lungs.
Okay.
Deep breath. Deep breath. Deep breath. Alright, Alright, I can definitely hear some bubbling or cracking in there, so that shows that there's definitely mucus buildup in your lungs, so we definitely do not want that. Alright, so I'm looking here at probably leaning towards bacterial pneumonia
Okay.
because some symptoms, the fever can range all the way up to 105 and yours was 103, so that's pretty close. Your lips do look a little blue. Can I see your hand? So do your nail beds. So that's definitely due to lack of oxygen in the lungs and the blood. So, and you're also feeling confused or delirious. Alright, I want to see what your lungs do look like, so I'm probably going to order an x-ray
Okay.
so we can just go across the hall now and get that done.
Okay. Come on in.
So I have those x-rays. So as you see here in the right lung, see this cloudiness?
Yeah.
Yeah, that's mucus. You can see it a little bit in the left lung,
Oh, yeah.
but it's mostly right in this area, in the right lung. So I think this definitely shows that you do have pneumonia, leaning still towards bacterial pneumonia as opposed to viral pneumonia just because you show more symptoms for bacterial. So I'm going to do a throat culture
Okay.
and send those tests. Alright. Have you ever had this test done before?
Not that I remember.
Alright. Open wide. Alright. I will go deliver this to the lab. Have you been taking any cough medicines recently?
I've been trying a couple different things to help me with my cough, but it's only seemed to get worse.
Alright. That's because cough medicines make it harder for your body to cough up the extra phlegm and mucus. That's why it's building up in your lungs. So you should probably stop doing that.
Okay.
Just drink a lot of fluids and get a lot of rest. Don't do household chores. Get a roommate, a sister, a mother to do that for you. And then control your fever with aspirin.
Okay.
And just take that as instructed by the bottle. And I will call you when I get the test back, and depending on what they look like, I'll call you back in, or
Okay.
we'll just go from there. Alright, so have a good day.
Thank you. Come in. Hi.
Hi. So the test came back, and unfortunately it does show that you do have bacterial pneumonia. So right now I'm going to prescribe you an oral medication, azithromycin. Have you ever heard of that?
I haven't.
Alright, that's commonly used to treat bacterial infections.
Okay.
So take that orally twice a day. I'm going to prescribe it for 14 days. It should clear up about the 1.5 week mark, but just to be sure and just to be safe that it goes away, I'm going to prescribe it for 2 weeks.
Okay.
Have you had any other serious illness such as heart disease, chronic obstructive pulmonary disease, kidney disease, or diabetes?
No.
Alright, that's good. Okay, so in addition to the antibiotics, you should obviously keep a proper diet, get more oxygen in the lungs because you need oxygen for the bloodstream, and also, do you still have the same level of chest pain?
Yeah.
Alright. So, in addition to azithromycin, you should be taking Advil to relieve chest pain,
Okay.
and that's going to help from obviously the pain in the chest whenever you cough.
Okay.
Alright, so like I said, it should take 2 weeks, and you should be feeling back to normal strength and feeling just 100% better.
Okay.
All right.
Thank you.
Nice to meet you.
You too.
Hope you feel better.
Thank you.